With Piedmont Healthcare and Healthy Morning contributor, Dr. Jane Morgan joins us now. Good morning to you.
Good morning,
Good to have you on the
Jane.
show as always. So,
thank you.
In a traditional emergency room, doctors are constantly making split decisions.
Sure.
How is this going to change the game for them?
Right, and there's a whole team in the emergency room. It's not just the physician. And so what we have to look at is whether or not this can impact busy ERs where there's volume, right? Where we're looking at the amount of volume and patients that are going through. Whether or not it can impact the triage process, meaning whether serious patients, we can make certain that those serious patients are getting through and there's not any type of human error or even bias. And then just trying to deal with sometimes there's miscommunication.
Right.
And that miscommunication train because the team is big. And we want to make certain that all of those things AI can come in and actually help and not hinder some of the challenges that we have in the emergency room.
How much human involvement should there be? Would you trust AI in an emergency room you're working in?
That's a good way to put it. Would I trust it? I would like to have it augment my decision making. And what I would like to be certain of is that it's giving me objective information. And so one of the concerns I have is whether or not, because it's trained on large sets of data, whether or not that implicit bias that we already are challenged with in our healthcare system, whether that will be a part of the training. And so therefore the information that we're getting from this GPT 4.0 can also begin to perpetuate those biases. The other things we have to think about are the nuances of language and whether or not we can actually get common sense answers from AI as opposed to a plausible response that lacks sort of real world experience and information.
So what challenges do you see in using AI for emergency situations? Could there be a false admission? Could somebody be getting treatment while somebody else has to wait for it that really actually needs it?
Right, all of the above. The same challenges that we have with humans, we may actually have those challenges with AI era as well, because we are training. They will be trained on they're already trained on large data sets, but humans generate these data sets. And so we want to make certain that as we're moving through that information is moved through in really a way that helps to facilitate the emergency room and not cause more errors or just kind of be in the way. But overall, humans need to have some oversight and control over what is happening. But AI should be able to really augment and facilitate that decision making, because so many data points can be handled. And we want to make certain that patients who are sick are seen, and if there's a triage situation, we know who is urgent, who's emergent, and who is not.
And outside of the emergency room, artificial intelligence is already being used in a variety of ways in the medical field.
Used and abused.
Yes. Telehealth, for example. Just talk a little bit about how we're seeing it manifested now.
Oh my gosh. I mean, we see it in all types of things, even with the wearables. And we want to be cognizant of how it's being used, because a lot of times the technology sort of gets ahead of where we need to be, and we want to make certain, especially that vulnerable populations and ethical concerns are considered, because people still have a lot of difficulty navigating the healthcare system, especially minority populations, especially people with language barriers. Is all of that subtle context going to be captured, or is it going to make the situation now even worse?
The potential for bias.
The potential for bias, but also algorithms and formulas that we are struggling with now in healthcare that have race factors in them that we are working to try to remove. Is that going to be part of the training, or will AI actually give us completely objective information regardless of the appearance of the person in front of you? And so that may actually help with augmenting or obviating some of that implicit bias.
Like incredible potential as long as those risks are kept at bay.
Right, like everything, right?
Exactly.
It's the yin and the yang, and we will have to see. It has the potential for abuse. It has the potential for incredible help with our health.
Such a fascinating field. Dr. Jane Morgan, always a pleasure. Good morning to you.
Thank you.
And after the break, it is